for talocrural joint traction is with the patient inside lying. What you can do is hook your elbow into the hook of their knee and increase the flexion until you get a good traction of the talocrural joint. So here, my left hand is on the talus, while my right hand is on the talus and calcaneus, tractioning the joint. Again,
the Casey non-surgical facelift utilises specific movements to lift the muscles back to where they used to be. It's totally painless and non-invasive. That's because it utilises electrical impulses at a similar frequency to how your muscles and brain communicate with each other. It literally re-educates your muscles. It's like a workout for your 32 facial muscles. You'll feel a difference after your first facial, and you'll continue to see improvements with repeated treatments. It works exceptionally well as a preventative treatment, as well as treating already established aging concerns. We offer a free, no obligation consultation and eye lift demo so that you can feel and experience the Casey effect for yourself. Give us a call or book your consultation today via our website at willowwellbeing.com.
Always under traction, you need to have two helpers. You can also use a belt, but with two helpers better. One that supports the trunk and one that supports the elbow. Here, under traction, place traction on the elbow, stay away from the wrist, and then you do some pronation and quick pronation, slow supination. Pop, pop, pop. And you bring it back. You can do this technique several times, another time. Stay shy of the full extension. You come back, you can retest and feel the pain.
the mouth and related structures, including the ventral of the tongue, the lingual veins,
These are the lingual veins.
the fimbriated folds,
Fimbriated folds are right on both sides. You can see those folds.
the lingual frenum, the Wharton's duct, which is on the sublingual caruncles,
Which are on both sides here, and the duct comes out right at the tip there.
and the sublingual folds. Then we'll
Of your colleague to help with the technique. So the colleague is going to maintain the scapula. My foot will be underneath the neck of the patient. Then I'm going to exert some traction. And from this position, traction, most of my force is on my hand underneath the neck. I can do the traction straight or the traction with rotation. You know, we're going to do a partial rotation of the neck. If we have done this technique one time or two times, no problems. On the second or third session, if they had an onset of the symptoms pretty rapid, we can also do a little manipulation, a little thrust. So here and a little thrust. Then we would come back in the neutral position and gently release.
Yeah, stick your tongue way out at me. Wait, and grab a hold of your tongue. I can see all the way back. pull it up. And up there. Good. And we're going to do the other side. Stick your tongue out at me. Great. And then I can see all the way back there. You see that lateral border, the side, and that underside. Good.
Typically do each movement 3 times and then move to another part of the scalp. Again, adjusting the pressure to suit the person receiving it. Again, do a combing motion through the hair. With the flat of your hands, gently scoop them underneath the head. Very slowly ease the head to one side, allowing it to rest on your hand. Be careful not to squish the ear. Use the hair washing technique to massage the back of the scalp. Slowly ease the head back to centre before repeating on the other side. Slowly bring the head back to centre and do some more hair washing techniques. Place your hands together like so and use the palms of your hands to massage the scalp. Once again, comb through the hair. Now repeat the pressure points, only this time do 3 small circles at each point. Skin type, and then it's time to really relax as you get to enjoy a gorgeous head massage too. Soothing heated mitts are then used to remove the remainder of the mask, followed by a tone to remove the remaining residue and close the open pores. We then apply an eye cream using lymphatic drainage movements to leave the eye area less puffy and looking brighter. And finally, it's finished with a moisturiser to suit your skin type, leaving you with silky smooth.
Place the sternocleidomastoid slightly on slack. When you palpate, you're going to position your fingertips on the superior aspect of the medial border of the clavicle, which may be slightly uncomfortable for patients. As you position as closely as you can to the sternoclavicular joint, you are going to do a caudal, slightly lateral, slightly ventral glide of the SC joint as you raise the arm into elevation. Just relax for me. As the patient improves with their mobility,
sensation. So I'm going to use my elbow on the front of anterior aspect of her shoulder. I'm going to place my hands very lightly on her head, and I'm going to turn into maximal contralateral rotation. Once I have that, I'm going to come down into ipsilateral cervical side bending. What I'm assessing here is my excursion. If the first rib mobility is normal, I should be able to come down all the way and not have any hard stop. Then I compare to the involved side. And again, my elbow is going to go on the anterior aspect of her shoulder to block trunk rotation. I'm going to be turning full range, cervical rotation to the right and left cervical side bend. If there's a limit, I'll have a hard end feel and I'll have decreased excursion. Limited excursion with the lateral side.
To move to a different area and work for a while. And I love to work this area here because we all have that forehead tension that we get when we're working on computers or driving, all of that kind of thing. And it's where you get a really nice lift on the eyes. That on just to facilitate the gliding of the cups. And people have cupping therapy for a variety of reasons, most often for cosmetic reasons. And the cups.
We're going to press down lightly in the region of the sublingual caruncles and repeat until a drop or stream of saliva is expressed.
I don't know if the video caught it, but saliva just came out.
Good.
Also really help with things like headaches, sinus issues, jaw tension, those kinds of things too. And it's just super, super relaxing. So it's a really nice thing to do for yourself or to give as a gift. And doing the upper lip. And this is so much more gentle and safer than doing any other kinds of cosmetic things. There's no penetration to the skin.